2, 3.
Hello everybody, I'm Tracy.
Hi, I'm Amy.
And we are some educators here at Cook County Health. This is our baby Tori. Just a little bit about our simulation center. It started approximately 2008 with our director, Dr. Sergel, who is an ED attending as well. She started in one of our old buildings and she had a tiny room, which was a dorm size room. And she was told that that is all the space she was going to get. And she was like, okay, I can deal with this. And then after a couple years, she's like, I need more space. I need a wall torn down. Well, the doctors told her there's no way you're getting a wall torn down. So our director was very adamant about expanding our simulation center, which at that time was just for emergency medicine. That's why she started simulation. So after a while of bugging, she finally got a wall taken down. She's the only person that has had a wall taken down in the old building that we were housed in before. So at that point we had 3 mannequins and the center was growing. We added more departments onto it because people were realizing that simulation-based training was more effective than just looking at a book or studying, or if the person couldn't get into a clinical setting, they could come up to the sim lab and practice on our mannequins and make the mistakes upstairs instead of going into the hospital to make mistakes. So in 2018, we built a new building here at Cook County, and the simulation center was granted 5,000 square feet here. And we have made the most of this lab. We have added some new babies. This is a newer baby. We just got him. We have moms that deliver babies, so we practice postpartum hemorrhage. We practice different deliveries. We also have a junior, 2 juniors, and we practice juniors. And then we have 2 life-size male mannequins, and we do simulations with them.
And all the task trainers. We have a lot of task trainers that we also do for residents, medical students. They get to practice central line invasive things that you can't just practice unless you come up to that opportunity. And now that COVID has happened, it's not really easily done because we need to worry about people's safety and everything else. So people are able to come here and practice on things and get as close to real life as possible. So that's something that people really like. Intubation, you could do intubation.
Intubation,
lumbar punctures.
Central line, lumbar puncture on adult and infant. We have lumbar puncture trainers. We have IV trainers. Lumbar puncture, central line. We have so many different things. We always forget. We're like, wait a second, what do we have? We just want to keep expanding. So Amy and I like to go out and spread the word of simulation. And because of COVID, we have seen an increase in people coming up to the sim lab more than ever before. So we have people stopping us in the hallways saying, hey, how do I get into that sim lab? So they reach out to Amy and I, and we schedule them, and they work with our director. And we also have a fellow in here that will be able to write cases. So when they come up here, we go through cases with their residents or students, and then they get debriefed here in the simulation center. So they are appreciating it much more since COVID has started.
So this baby here, this is baby Tori. Baby Tori is very high tech. She could be a she or a he. So we do have him currently covered. But Tracy is more of an expert on this little guy right now. I haven't really dug much into him, but he can be a female as well.
He can be calved. He can have an IO. We can see cap refill on him. We can set cap refill for him. We do have an umbilical cord that we can put here, and they can do IVs through that. He has fontanelles that bulge and sink in. We can start IVs on his head. He has heart sounds, lung sounds, bowel sounds. You can see his little mouth and face move. He does cry and grunt. He is a cute little guy and moves all over the place. He can also seize, so he does have seizures if we want him to have seizures. He can be defibrillated and paced if need be.
We're also working on getting another baby in here, which is actually made by Laerdal. Most of our equipment is Laerdal based. That's what we use as monitoring and things like that. So they have a brand new baby that we are in the process of working on getting, but of course that does take some funds. So we do need to figure that out. Tracy and I were actually looking into potentially getting a grant or something to try to go about that. But this baby is a little larger, and he's just as cool. So we are trying to expand as far as what we're capable of, because the better we can be in here, the better training gets provided for people to go out there in the real world and really do this.
So
I think that kind of sums up for now, but this is not going to be the last you're going to hear from us.
Not the last you'll see of us.
Can I ask you guys a question? Can you tell me, how do you think the simulation lab helps the international medical graduate? As you see, we have so many of them online from all over the world that can't come here to the U.S. hospitals. How do you think this lab helps them?
Do you want to answer that, or do you want me?
I think any simulation-based training helps, and I imagine it's not really as worldwide as it is here in America. Of course, I have no idea. I don't know what different countries are capable of or have as far as equipment and technology, but I do know that America has more, maybe an overabundance of things. I don't know if I'm saying that right. But simulation itself is something that is more of it's like a privilege to even experience it, in paramedic school, or even just in regular medical schools. You don't just have this opportunity. It doesn't just present itself. It does come with quite a bit of funding and experience and knowledge-based training behind it. It's not just something that is thrown together. Our physician takes so much time into the cases, before the cases, after the cases, during the cases. It's just a different way of looking at learning. And after the very first few times that you do simulation, at first it's kind of awkward. You look at this as a mannequin. After a while, you actually start to get used to it, and you look at it as if it's a real person. So all of the simulation artifact, as they say, starts to go away. So when you do assess this baby, you do know exactly where you can put that IV or where you can check their pulses. It starts to make it more real. And for any students, whether international or here, it's definitely a safe way of learning. It's a safe environment. It's a safe experience. We don't like people to kill their patients ever. And we try to avoid that from happening by maybe taking pauses during simulations, because you want to keep that positive experience for them. Sometimes you could take away something negative from simulation, even if you didn't mean to, and it can actually kind of hurt you at some points. So it is very important that physicians or some experts in simulation stand behind everything that we do. I think it's extremely important for learning. Even if COVID wasn't going on and you had a chance to do simulation, it's something that is now going to grow more because of COVID, because we've now realized, we need to keep our distance, we need to keep ourselves safe, we need to keep things cleaner. How can we really do that? How can we learn then? So this has really kind of shined through everything, but at the same time, for people that have experienced simulation, they continue to experience simulation. They don't let that practice go. And so I think even with or without COVID in the picture, it's extremely important to get simulation-based training, whether it's, in the beginning of your medical experience, middle of your medical experience, or even just your ongoing, because as we all know, the medical field changes on a daily basis. The American Heart Association just put out their new updates, which they did dive into a lot more pediatrics, and everything continues to evolve and change. And what we thought we knew before continues to either come back or change in some other way. So it's extremely important that you have a safe space to be able to learn from, make mistakes no matter what point of your career you're in.
And I think from them being international students and doing these cases, there's different culture here in America than they may have experienced back home. So I think it's a great introduction to American medicine and how we do things here, and just the different scenarios that they may come across here in the States, because they may not see these type of things where they've come from.
Right. Yeah, and especially with just the different terminology of things or the different ways of testing. It's just different. In different countries, even just something as simple as the ventilator. Ventilators are ran by nursing and physicians in Europe, whereas here we have an actual respiratory department. So yeah, it's definitely just experience, and we like to think it's positive, especially dealing with us because we're happy people, and we really love our job over here.
And we get to be creative. That's a great thing too.
Yeah, we get to play while we're at work. It's a lot of fun.
Nice.
And we have an amazing boss who lets us be silly.
Awesome. Thank you guys so much.
Thank
we
you.
appreciate you.
We appreciate you guys.
Yeah, we love you guys.
Thank you.